Hey everyone, my name is Mariam Yusuf and today I'll be recording this presentation on behalf of Ms. Mariama and Dr. Musa. The presentation's topic is, should genetic screening be mandatory for certain high-risk professions, example, pilot, doctors, nuclear plant workers? So, as previously mentioned, we will be discussing a topic that sits at the intersection of science, ethics, and public policy, the mandatory use of genetic screening in high-risk professions. With recent advancements in genetic screening technologies, we now have powerful tools to better understand individuals' susceptibilities to various medical conditions. This opens up exciting possibilities for improving health outcomes through early interventions and proactive risk management. However, reducing mandatory screening, especially for professionals such as pilots, physicians, or nuclear plant workers, raises complex ethical, legal, and social concerns. In this presentation, we will explore both sides of this debate, aiming to balance the rights of individuals with the safety of the public. Let's begin by understanding what genetic screening really entails and why it's becoming such a relevant topic in occupational health today. Genetic screening in high-risk occupations is not just a scientific issue, it's an ethical balancing act. On one hand, there is a compelling argument in favor of using predictive genetic data as a proactive safeguard in roles where sudden health crises or impaired decision-making could lead to catastrophic consequences like aviation, medicine, or nuclear energy. Early identification of risk can potentially save lives. On the other hand, requiring such screening raises deep concerns about privacy, autonomy, and fairness. Critics warn that it could be or it could open the door to genetic discrimination, and more troubling, that we may place too much weight on genetic probabilities without fully understanding their limitations. So in this discussion, we need to ask ourselves, does the goal of preventing harm justify the potential infringement of personal freedom, and are we ready to handle the social implications of such a policy responsibility? That will be our question for today. So let's begin with our strongest argument in favor of required genetic screening, enhanced public safety. In high-risk professions like nuclear engineering or aviation, even a momentary lapse in judgment or sudden medical event can lead to catastrophic outcomes, not just for the worker, but for hundreds or even thousands of others. Genetic screening could help identify individuals with significantly higher risk of sudden onset conditions such as hereditary cardiac arrhythmias, certain neurological disorders, or severe psychiatric conditions. While traditional medical exams focus on current, genetic testing add a proactive dimension by forecasting possible future risks. In this way, it becomes a powerful preventative tool, one that could save lives by allowing for early intervention. For a public safety standpoint, the benefits of foresight in these environments are difficult to ignore. On the public safety argument, let's now consider two additional advantages of required genetic screening. First, active risk management. Knowing someone's genetic susceptibility allows employers to take targeted and ethical actions, such as enhanced monitoring, preventative treatments, or modified duties. Take, for example, a physician with a family history of genetic risk for early onset dementia. Rather than being excluded outright, they could be offered regular cognitive assessments, or their responsibilities could be adjusted in a way that maintain both safety and dignity. Secondly, the economic case. While genetic testing can be expensive upfront, the long-term saving can be significant, preventing just one serious accident in a high-stakes swap can avoid the enormous costs of investigations, lawsuits, compensation claims, and retraining. So on a broader scale, maintaining the health and productivity of highly trained professionals help reduce medical costs and workplace disruptions. We have the upholding high professional standards. In many critical fields, whether it's surgery, aviation, or nuclear operation, consistent performance and reliability aren't just preferred, they are essential. These professions already require rigorous physical, psychological, and cognitive evaluation, so adding genetic screening could be viewed as a logical extension of existing standards, a way to ensure individuals are as fit as possible for the demands of their role. Second, excuse me, technological advancements. Genetic screening technology is rapidly improving in both accuracy and predictive values. As our understanding of the relationship between specific genes and disease risk evolves, the potential to identify actionable, preventable risk becomes increasingly realistic. What was once considered speculations is now become a reliable tool in personalized medicine, and for high-risk professions, this opens the door to smarter, safer decisions making based on sound genetic science. Now, shifting to the opposing side, one of the pressing concerns about mandatory genetic screening is the risk of discrimination and privacy violations. When employers have access to someone's genetic profile, even with good intentions, it opens the door to unfair treatment. Individuals with certain genetic predispositions, even if they are completely healthy, might face stigma, limited opportunities, or be deemed too risky for certain positions. This raises a fundamental ethical question. Should people be judged by who they are today or by what they might become in the future? Moreover, it threatens the right to medical privacy. Unlike routine physical, genetic data is deeply personal and potentially predictive about not only the individual but their family. This concern is serious enough that the United States enacted the Genetic Information Non-Discrimination Act, or the GINA, to prevent such misuse in employment and insurance settings. The very existence of this law highlights the risk of social harms if genetic data is not handled with extreme caution. Another point is that genetic information is not definitive. It's a matter of probability. Just because someone has a genetic predisposition doesn't mean they will develop a condition. Most complex diseases involve a combination of genetic, environmental, and lifestyle factors. So screening might unjustly exclude individuals who are perfectly capable and healthy simply because of possibility. On the flip side, it may give others a false sense of security if no risk markers are detected. Even more challenging is the concept of the variant of unknown significance, or VUS. These are genetic findings we don't yet fully understand. They can create confusion, unnecessary anxiety, and make decisions even more complicated. Ultimately, using such uncertain information as a basis for employment decisions could be both ethically questionable and scientifically premature. Next is the ethical issues and informed consent. There are significant ethical concerns with informed consent and physical autonomy when people are forced to submit genetic testing against their will or as a requirement of employment. Individuals' genetic information is extremely personal and can have significant effects on their family members as well. So the next argument is the cost and resource allocations. Setting up and maintaining widespread mandatory screening programs should be extremely expensive, involving genetic counselors, lab infrastructure, data protection systems, and follow-up care. Many argue that these resources would be better invested in strengthening existing occupational health programs, routine monitoring, or addressing known immediate workplace hazards, things we already know how to manage effectively. The last two reviewable points, the psychological impact. Even when no symptoms are present, a positive genetic test result can trigger significant anxiety, stress, and emotional strain. For some, knowing they carry a genetic risk, even a small one, may overshadow their sense of identity, increase health-related fears, and affect their performance. And then, lastly, is genetic testing even necessary right now? So alternative and current safety measures, strict medical exams, psychiatric assessments, performance appraisals, and safety procedures are already in place for high-risk occupations. It's suggested that focusing on workplace culture and mental health system as well as investing in the ongoing implementation and enhancement of these current measures provides more immediate and certain safety benefits that speculate genetic screening. Lastly, although there is no denying the appeal of using genetic screening to forecast and avert catastrophic events in high-risk occupation, the significant ethical and practical issues it raises necessitate considerable care. A general mandate for genetic testing is directly at odds with the fundamental rights to privacy and protection from discrimination that are protected by numerous legal systems. Furthermore, the assurance of the prophylactic benefits of genetic information is undermined by its probability nature, the possibility of misinterpretation, and the substantial psychological load of those who are predisposed. Society should place a higher priority on bolstering current established safety procedure rather than enforcing such a very personal and maybe discriminatory approach, promoting a culture of all-encompassing occupational health care and funding studies that can convert genetic findings into genuinely practical and fair preventive measures without undermining personal freedom or producing a new class of unemployable people based solely on their genetic makeup. Basic human dignity must never be sacrificed in the name of safety. Some references used in the presentation. So much for listening, and now we open the floor for questions and answers.